An older adult had a previous history of constipation, diarrhea, loss of appetite, and nerve problems like numbness or tingling, muscle weakness, and problems walking. Which of the following contributes to vitamin B12 deficiency in older adults? A. Atrophic gastritis. B. Helicobacter pylori infection. C. Reduced secretion of intrinsic factor. D. All of the above. As the person is aging. The correct answer is letter D. All of the above. Rationale: atrophic gastritis leads to reduced secretion of intrinsic factor from the gastric parietal cells. Helicobacter pylori is the usual cause of atrophic gastritis. The nutrition issues that older people face can be very different from those that many others seem to face. In order to achieve optimal nutritional status, it is recommended that older adults consume a low energy content diet, B. a daily antioxidant supplement, C. a high energy content diet, D. a high nutrient dense diet. Answer is letter E, dense diet. Rationale: older adults tend to consume less food and therefore it is more difficult for them to achieve recommended intakes of micronutrients. It is therefore recommended that older adults consume a nutrient-dense diet. Malnutrition has a complicated and multifaceted etiology, and it has been acknowledged as a challenging health concern. The development of malnutrition in the elderly is likely also aided by aging processes. Malnutrition in older adults is associated with which of the following? A. An improvement in physical function. B. Reduced length of hospital. C. An increased mortality and morbidity. D. A reduced susceptibility to infection. The correct answer is letter C. An increased mortality and morbidity. Rationale: according to studies, malnutrition in older persons is linked to higher rates of death and morbidity. Their bodily function deteriorates as a result. Additionally, there is a reduction in respiratory and cardiac muscle performance, which raises mortality and morbidity. Our skin goes through a lot of changes as we age. Your lifestyle, nutrition, genes, and other personal habits will all have an impact on how quickly your skin ages. The most important nursing intervention to correct skin dryness is A. Encourage the patient to increases fluid intake, use non-irritating soap when bathing the patient, and apply lotion to the involved areas. B. Ask the physician to refer the patient to a dermatologist, and suggest that the patient wear home laundered sleepwear. C. Consult the dietitian about increasing the patient's fat intake, and take necessary measures to prevent infection. D. Avoid bathing the patient until the condition is remedied, and notify the physician. The correct answer is letter C. Encourage the patient to increase his fluid intake, use non-irritating soap when bathing the patient, and apply lotion to the involved areas. Rationale: dry skin will eventually crack, ranking the patient more prone to infection. To prevent this, the nurse should provide adequate hydration through fluid intake, use non-irritating soaps or no soap when bathing the patient, and lubricate the patient's skin with lotion. The nurse should apply lengthy, firm strokes from the distal to the proximal areas when bathing a senior male client who is unable to care for his extremities. This bath technique is known to A. Causes vasoconstriction and increases circulation. B. Avoids undue strain on the nurse. C. Provides an opportunity for skin assessment. D. Increases venous blood return. The correct answer is letter D. Increases venous blood return. Rationale: washing from distal to proximal areas stimulates venous blood flow, thereby preventing venous stasis. Good personal hygiene is essential for skin health, but it also has an important role in maintaining self-esteem and quality of life. Supporting patients to maintain personal hygiene is a fundamental aspect of nursing care. The usage of restraints in home care is a complicated and difficult problem. The use of restraints in home care, its effects, and the ethical issues associated with it must all be understood in order to reduce its use. Restraints can be used for all of the following purposes except to A. Prevent a patient from becoming confused or disoriented. B. Discourage a patient from attempting to ambulate alone when he requires assistance for his safety. C. Prevent a patient from falling out of bed or a chair. D. Prevent a confused patient from removing tubes, such as feeding tubes, IV lines, and urinary catheters. Correct answer: A. Prevent a patient from becoming confused or disoriented. Rationale: sometimes hospital patients who are confused need restraints so that they do not remove catheters and tubes that give them medicine and fluids. A nurse who has special training in using restraints can begin to use them. A doctor or another provider must also be told restraints are being used. The doctor or other provider must then sign a form to allow the continued use of restraints. Few studies have examined how elderly residents of nursing facilities view their final years. Furthermore, there has been little prior research on how older people see death and dying. Therefore, it is crucial to investigate what they went through in their final years. Kubler-Ross's 5 successive stages of death and dying are: A. Bargaining, denial, anger, depression, acceptance. B. Denial, anger, depression, bargaining, acceptance. C. Anger, bargaining, denial, depression, acceptance. D. Denial, anger, bargaining, depression, acceptance. Correct answer D. Dabda. Denial, anger, bargaining, depression, acceptance. Rationale. D. Kubler-Ross's 5 successive stages of death and dying are: first, denial, anger, bargaining, depression, and acceptance. The patient may move back and forth through the different stages as he and his family members react to the process of dying, but he usually goes through all of these stages to reach acceptance as the last stage. As older adults approach the end of life, EOL, many are faced with complex emotional and psychological issues. A terminally ill patient usually experiences all of the following feelings during the anger stage except: A. Rage, B. Numbness, C. Envy, D. Resentment. Correct answer B. Numbness. Rationale. The anger may also be generalized and undirected, which may include rage, envy and resentment, which could be manifesting as a shorter temper or a loss of patience as emotion is raging. Thus numbness is irrelevant in this situation. Recognizing anger as a natural response can help healthcare providers and loved ones to tolerate what might otherwise feel like hurtful accusations, though they must take care not to disregard criticism that may be warranted by attributing them solely to an emotional stage. Adult client is terminally sick. Most nurses and other healthcare professionals frequently struggle to guide them through the required steps leading to death acceptance. Which of the following approaches will help the nurse to accomplish this goal the most? A. Taking psychology courses related to gerontology. B. Reading books and other literature on the subject of thanatology. C. Reflecting on the significance of death. D. Reviewing varying cultural beliefs and practices related to death. Correct answer C. Reflecting on the significance of death. Rationale. Reflecting on the significance of death helps to reduce the fear of death and enables the healthcare provider to better understand the terminally ill patient's feelings. It also helps to overcome the belief that medical and nursing measures have failed when a patient cannot be cured. A 62-year-old client's blood pressure at a community health fair is 160/96 of a millimeter of mercury. My blood pressure is often significantly lower, the client says, thus the nurse should advise the patient to check blood pressure again after a month. B. Come back and get a blood pressure check within the next 15 minutes. C. See the healthcare provider immediately. D. Visit the healthcare provider within 1 week for a BP check. Correct answer, B. Come back and get a blood pressure check within the next 15 minutes. The blood pressure reading is slightly elevated, necessitating a follow-up check to confirm a few minutes later. The client claims that it is normally substantially lower, hence there is cause for concern regarding side effects like stroke. Options A and D. Waiting a month or even a week for follow-up is too long. Option C. Immediate check by the provider of care is not warranted.